Good evening to all our participants and welcome to another AeHIN Hour webinar. Please be reminded that all participants' microphones are muted throughout the meeting. For comments, please use the chat box, and for questions, please use the questions box. Our speakers for tonight are Ms. Rebecca Alban and Sir Wesley Brown. Ms. Rebecca is the OpenLMIS Community Manager. Her role is to support and promote the growth of the OpenLMIS community, fomenting new meaningful partnerships and coordinating communications and advocacy on behalf of the OpenLMIS initiative. Ms. Rebecca is also a global health professional with over 10 years of experience in public health program management, implementation, and capacity development. We also have Mr. Wesley Brown, the Technical Product Manager on the OpenLMIS and a Senior Technical Manager with Village Reach. His background is designing and building software solutions and managing software development teams, most recently working in the health IT space for health systems and institutions in low resource settings. So may we now pass the presenter controls to our speaker.
Hi everyone, this is Rebecca. Chuck, can you see my screen?
Yes, Ms. Rebecca, thank you.
Great. Thanks everyone for welcoming us. Wes and I are very excited to be here today to present some information about OpenLMIS, so thank you for having us. I think I'll just get started and dive in with our webinar outline for this evening. Our overall goal is to really just present an overview of what OpenLMIS is, how it helps countries to improve the availability of medical products in clinics. It's not going to be an overly technical presentation. So I'll start by diving into sort of what the core problem is that OpenLMIS is trying to address and setting a little bit of context. And then we'll actually get into the OpenLMIS product itself, talk about the processes it supports, how the technology is managed, and I'll speak about our open source community. And then we'll move on to the features in which Wes will walk us through the functionality and specific features of OpenLMIS and show you a little bit what it looks like to use OpenLMIS in action. And then lastly, I will just take some time to reflect on the impact that OpenLMIS has had for the countries who are using it. So first, I just wanted to introduce an acronym that we're going to be hearing a lot through the presentation, which is LMIS. And that stands for Logistics Management Information System. And essentially, a logistics management information system is an electronic system that helps countries to manage their public health supply chains. And I'll get into a little bit more what that means, but just so you know, you'll be hearing a lot of LMIS through the presentation. So this is to set a bit of context. I wanted to show you this diagram of what a basic supply chain for medicines looks like in any given country. This is just a generic overview. So starting at the top, you see the central warehouse where products would enter a country and then they would need to be distributed and tracked and continually supplied to the different regions and districts so that they can ultimately reach health facilities and patients. And where OpenLMIS comes in is that the processes you see in blue. OpenLMIS helps to lower level facilities to request new stock so that it can be ordered, fulfilled, and shipped, and then received again at the lower level. So there's sort of this cycle of processes. And OpenLMIS is an electronic system that helps countries to do that. It's a system that's been purpose-built to manage these particular types of supply chains in lower to middle income countries. And the software can work in any product area. It can work with TB, malaria, family planning, essential medicines, and we also have a special module that focuses on vaccines. So this is just to show you where sort of OpenLMIS fits in a country context. I'm just trying to advance the slide. Here we go. Um, and here I just wanted to touch on some common information system challenges that we see really when implementing any digital systems that OpenLMIS tries to address. One is that digital solutions tend to be fragmented across different programs and countries designed for a very narrow purview, and that means they can't really be shared or repeated. Another problem that we see quite often is that the existing paper-based information systems tend to yield poor data quality. So we see very low reporting rates, inaccurate data in those reports, and frequent calculation errors when it comes to managing this type of data in a paper-based form. And proprietary digital systems tend to be quite expensive. They're expensive to set up and expensive for countries to maintain because they have licensing fees. So with no sort of global coordination mechanism, each country, we're seeing countries over and over again who are sort of reinventing the wheel for the same needs over and over and having to pay for it. And OpenLMIS addresses that issue in that it is an open source technology, which in our case, by forming a global community of users, we really aim to reduce that fragmentation and allow each country to adapt the technology to meet their needs, but not having to recreate the wheel over and over and create new custom systems, which are expensive to donors and difficult to maintain. I'm gonna have to advance like this. The benefits of OpenLMIS are demonstrated on this slide here. So overall, OpenLMIS is designed to inform decision making so that governments have high quality data to use when they are ordering and resupplying their drugs. It helps stakeholders to know how much they've used and therefore estimate how much drugs they'll need in the future to ensure that they are adequately stocked. But some of the specific benefits of OpenLMIS are that it improves data accuracy through our automated calculations and different data validation checks, which Wes will show you a bit later. Data is more accurate when entered in OpenLMIS. It also can improve the timeliness of data, or the reporting timeliness, I should say, through easing the burden of healthcare workers for entering and reporting data. It makes the process for them much easier and quicker to capture data and report it to other levels of the supply chain. And OpenLMIS, probably most importantly, increases data visibility across the supply chain. It helps stakeholders and other supply chain actors to see what's happening across the supply chain and where there are shortages and what is needed across the entire country. And that thereby increases accountability, and it also increases transparency for the different supply chain actors. Why is this not advancing? Sorry. Here we have a slide about really the vision and the values that the OpenLMIS initiative holds dear. The first thing you see here is called the shared investment and shared benefit concept. And that really refers to the fact that OpenLMIS has a community approach to share its codes and features across a community of users, which we think is very unique. So any country who implements OpenLMIS is then considered to be part of this community and will continue to benefit from upgrades and enhancements that are made to the code. So this is how we see the software sort of improving over time, and all of the users continue to benefit. Another principle we adhere to is interoperability. And that really means that our system has been designed to work with other systems. OpenLMIS does not try to meet all of the needs of all the digital solution needs across the supply chain. It sees that systems should be designed for specific purposes and work well with others so that all of a country's needs can be met across their ecosystem. So we work well with systems like DHIS2 and warehouse management systems so that our data can speak to other systems and we can receive data and pair data with other systems. And the last principle you see here is configurability. And that really means that we've designed OpenLMIS in a way that allows countries to sort of make the software their own. They can easily configure a system to their own country context and their own needs and their own programs. So it's very sort of user-friendly and easy for countries to make sort of customized based on what their needs are. And now I'll talk a bit about our open source community. OpenLMIS is also quite unique in that it's not particularly owned by one organization or company. It has historically been a donor-funded initiative, which employs an open source community of partners, which serves to govern the software and also to make key decisions about how the software should be implemented and how the software can be improved over time. And actually, that's a main function of my job, is to coordinate all of this partner input and make sure that it is sort of filtered into the community and that voices are heard from all of our global partners. And this is just a snapshot of who those global partners are that make up our community. And there are over 20 of them. So it's quite a lot of different perspectives and sets of expertise that we have and we value. At the top, you see our implementing partners, who are actually the organizations who employ OpenLMIS on the ground and do a lot of the implementation work. And they are organizations with expertise in supply chain, in global health, and also in technology. And then our other community partners that you see at the bottom are donors and other technology partners who really provide strategic guidance and are thought partners in many of our initiatives. And the way community partners provide their input is through community committee meetings, which we hold regularly to sort of talk about governance issue with the technology and also technical meetings that talk more about the features and architecture of the software. So now I think I'm going to turn it over to Wes to talk about the specific features of OpenLMIS and give you a picture of what the system looks like.
Great, thanks, Rebecca. And thank you very much to the community here for giving us an opportunity to share a little bit about OpenLMIS and how it works and what we're doing. So this will just be a very brief overview of some of the high-level features of OpenLMIS. I think that there's time at the QA time at the end. If there's any specific questions, we can follow up on. Yeah, so if you want to go to the next slide, Rebecca. Sometimes it's easier to understand how the system works a little bit by understanding the users that would actually be using the system. So this is a representative workflow. It's not the only one. In fact, OpenLMIS can support many different workflows, but this is just a common one that we've seen, where a storeroom clerk would be submitting a requisition. And a requisition is just that the request for new supplies at a given facility. So we call that a requisition in our system. So a storeroom clerk would be submitting that, and then you can see here it would flow through these different steps with different actors involved in each one of those. So it can get authorized and approved, turned into an order, and then delivered to a client site. So this is the kind of process that OpenLMIS facilitates. If you go to the next slide, Rebecca. A big piece of this, though, is that OpenLMIS is very configurable. So if you have an environment where you don't have regional and district and facility levels, you just have district and facility levels, OpenLMIS can support them. So it's flexible on many different areas, so that it can ramp up to be a whole national scale, which is in fact how it's been used quite often, but also could be scaled down to be used in a much smaller scenario as well. So the system itself you're able to change it and make it adaptable to the scenario that you're in without requiring a developer. So that's one of the key pieces here. This configurability is built into the system so that you don't have to go in and change it with expensive developer time. Next slide, please. So here's just a snapshot of the high-level OpenLMIS features. And really, it's built around stock and inventory management, order fulfillment, and requisitions. And then we also have integrations with different mobile solutions, including OpenSRP, as well as an integration with equipment tracking, so cold chain equipment tracking. And then we have an analytics engine on top of all of this so that you can get data out and be able to see how is your network overall doing in terms of gathering the data that you expect them to gather. So once again, the requisition piece is about requesting new supplies into your facility. And then the order fulfillment is turning a requisition into an order that your warehouse would then deliver onto a facility. And then the stock and inventory management generally is used by facilities to keep track, of course, of their stock and their inventory at that specific facility, which then ties back into the requisition and starts that cycle again, that cycle that Rebecca had shown earlier. So to start, I'll discuss a little bit of how that requisitioning and order fulfillment process works, since that's really the heart of what OpenLMIS provides. So it'll be those two pieces there in the middle. Go ahead to the next slide. Thanks, Rebecca. So this is a screenshot of one of our pages, one of the main pages that users would be using within OpenLMIS, and this is our requisition page. So you can see here that this list is pre-populated with something that we call a full supply product. You can see that there in the middle of the screen on the left. And a full supply product is just a product that is expected to be at every facility. Every facility should be fully supplied of these products. So by default, OpenLMIS will show all of those when you start a new requisition, when you start requesting new stock, because you have decided when you've configured OpenLMIS that every facility should have these. And this is configured based on both facility, but also program level. You can also have what we call very originally non-full supply products, which are products that you don't have to have at every single facility. So the system does support both, but in most cases you want, at least in the medical facilities that we're working with, there's almost always a list of products that they always want to have on hand. So you can see here that there's a number of different pieces of information that you can gather. And this list here, this table at the bottom, is totally configurable. So you can define which pieces of information you need to gather, how you want to gather, and the system will automatically populate them appropriately. In this example, we're looking at an order that's been automatically calculated based on the average consumption for the past 3 months. That's just one of the automatic order calculation processes that we use. There's others, and you can also create your own if you want. So this system is, once again, very configurable, very flexible, because we know that every country and many different institutions have their own process for how the requesting of new things should work. All right, so go on to the next slide, please. Now, one of the key features that we had to build into OpenLMIS because of the areas where we work was support for intermittent internet connections, so internet connections that are going up and down. And so in the requisition pieces that we have within OpenLMIS, it will work even if you're offline. You can see here in the upper right-hand corner, it's telling the user, in this case, that they're offline, and but they're still logged in, and they can still use the system, and not just still be able to use it, but they can actually save, like in this example, they could save a new requisition, and that requisition would stay on their computer. They could continue to do the work they needed to do, and then once they're online, it would automatically sync up. So that most of the time when you're on a web page, if you were to click a button to save something and you're offline, you're going to lose all the work that you did. But in OpenLMIS, you'll actually save it and continue on. And like I said, most of the reason for that is many of the facilities where we're working at, the internet connections are not great, and so being able to mitigate that is a very important feature for OpenLMIS. Next slide, please. The next major feature is the stock and inventory management. I would expect that this is fairly self-explanatory, but this is just the management of the products and supplies that your facility may have on hand. And OpenLMIS has a focused and a simplified stock management system. OpenLMIS is not an ERP. It's not intended to be. Rebecca was mentioning earlier that we as OpenLMIS, we want to integrate with other systems and not try to replace them. So we have taken a very consistent approach to using standards to be able to integrate with other systems such as ERPs, while still providing the functionality that we need within OpenLMIS to be able to do our core functionality. Our stock and inventory management is really built around facilitating the requisition and order fulfillment process. Next slide, please. So here we can see an example of one of our pages on the stock management piece. This is a physical inventory or a stock take page. And I'll just highlight a couple of things on here. First is that this is looking at the stock for a specific facility and a specific program. And we can see here that it just has what you would expect. It has the product and the stock that you have on hand. But then it also does support defining expirations and lot codes if you have products that have those. You don't have to have those, but for many of the kind of pharmaceuticals that we're dealing with, that's very, very common. The system is good about keeping track of exactly how many you have at each lot, and also being able to roll those up. So you can see, like in this example, we have 50 of the Lavora, 5 of which have no lot, and then 45 which have that lot that's defined there. And then on the right-hand side, we can see some of the other stock operations that can be done. Like I said, it's not a full-fledged ERP. It's not intended to be, but this is good enough to be able to use to manage your stock at a facility and be able to keep track of it. And then all of this information, most importantly, flows back into our requisition process, so that when it comes time at the end of a month or the end of a quarter to do a new requisition, you already have the pre-populated quantities, so you don't have to enter those in again. Next slide, please. The last piece that I'll go over today is the analytics and reporting. And for most of the managerial users, people who are pushing their users to use the system, this is the piece that is actually the most important to them. This is the carrot that drives a lot of the kind of drudgery of having to enter in a lot of data. We use a system, an open source system from Apache called Superset, which is a very nice data analytics and reporting solution that sits on top of OpenLMIS, or actually next to it. If you go to the next slide, we can see some screenshots of just some of the kind of reports that we can present. So you can see here the very nice visualizations. And one of the great things about this, I won't go into the specifics of what all these reports are, but these are all reports that can be easily created without having to use any code, without having to have a developer go in and try to figure out how to make these look pretty. You're given a set of data, and Superset can show you a whole bunch of different visualizations, including the kinds that you see here, to be able to really break out the data so that it's very obvious that what data you're looking at and which that important key pieces of information come out and are obvious. Next slide, please. So then just to conclude, looking at what are the main benefits of OpenLMIS, and we've divided this into 2 categories, looking at it from the perspective of the users who are using the system, as well as for the system overall. And from the users, they really do benefit from the data validations and the faster data calculations, and usually better data calculations when we're using the automatic order quantities based especially on average monthly consumption. It gives a much more accurate viewpoint of what those quantities should be. And then you also get the offline functionality, which is vital to many of the localities that we're working in. And for the management, they love to be able to see the visibility in the reporting capabilities, but also specifically the reporting rates so that they can identify if there are regions that are having more difficulty doing the requisitions on time for some reason. They can start to investigate that. And then, like I mentioned before, how OpenLMIS can interface with other systems, including ERPs. That's a critical piece these days. So many institutions and large health networks rely on their ERPs to be able to be the one source of truth for as much of their data. So rather than duplicating a lot of that, we just integrate with ERPs that can provide that data and then stream it in to OpenLMIS. Now, one of the benefits of OpenLMIS as compared to many ERP systems is that we have a very deep understanding of the requisition process and a system which allows a great deal of flexibility and power within that process. Whereas most systems, it's kind of an add-on. This is core to what OpenLMIS does, and we do it quite well. On the big picture side of things, OpenLMIS is an open source project, so all of the source code that our developer teams are working on is open source. Much of the work that we do is put up on our wiki. We're very open and inclusive in terms of the communities that we have and involvement that we have from our different partners. We really value the trusted partners that we have and the implementers who are using the software. And we continue to try to expand the system so that the community is benefiting from each community member. We also have a long history of experience in many different countries, primarily in Africa, sub-Saharan Africa, but that experience has really helped us as we continue to adapt the system. We're able to continue to leverage the experience that we've had from previous implementations. And then this, the benefit of the future enhancements, well, one of the core tenets of OpenLMIS since version 3 is that each version going forward is backwards compatible, fully backwards compatible. And in fact, when we do a new release, part of what we do is we do that upgrade. And if it doesn't upgrade smoothly, then it does not get released. So that means that if you were to use OpenLMIS and you're able to get the latest changes and fixes and enhancements without having to worry about the backwards compatibility, because that's part of what we do when we do our testing. And then that last piece is just that countries or implementers get to choose which pieces of the system they want to turn on and off. The system has been designed very intentionally so that you don't have to use the whole system. For example, if you don't want to be using the stock management piece because you have something else that does that, that's fine. You can just plug in the requisition piece and import that data if you want to from the other system. And that kind of carries over to many different areas of integrations that we have with other systems. OpenLMIS is much more interested in partnering with other organizations and other projects that do really good work in a specific area rather than trying to duplicate that work ourselves. So those are the main benefits from OpenLMIS and just a quick summary of the features. And like I said, if you do have any specific questions, we'll love to answer those in the QA portion of this. But for right now, I think we're going to hand this back over to Rebecca.
Thanks a lot, Wes. That was a great overview. I think we'll move on now to talking about how OpenLMIS has impacted the countries that it is being used in. So first I can start by just giving you an overview of the countries it's being used in. As you can see here, the implementation of OpenLMIS continues to grow, and we're in a growing number of facilities each year. The graph in white shows where we started as an initiative in 2012. And if you look toward the right-hand side of the graph, you'll see now that we are in over 11,000 health facilities managing those logistics processes across Africa, mainly West and Sub-Saharan Africa. And you can see the map on the right. The countries that are highlighted in blue are where OpenLMIS is being used. OpenLMIS can take many different names. So some of the countries have different names for the system that they either use their own acronyms or they're in their own language, but these 8 countries is where some version of OpenLMIS is currently being implemented. And as Wes pointed out, most of our experience is currently in Africa, but in this coming year, we are hoping to expand our footprint more into the Asia continent, as we're seeing more and more the supply chain needs and the supply chain processes are very similar. So that's one of the reasons we're excited to be speaking to your network today. This is a comparison that we did in Mozambique a few years back to show how the system can impact the health workers that use OpenLMIS. Wes talked a little bit about the health workers that have to enter in the data and the calculations that they would need to be doing in paper form without OpenLMIS. And historically, that was taking people around 3 hours to sit behind a desk and add up lots of numbers and do the math that they needed to do each month to order their supplies. In comparison with OpenLMIS, those calculations are pretty much automated, and there's data validation checks to show that they're accurate. So you've got a time taken to perform order calculations comparison of 3 hours or about 1 minute with OpenLMIS. And that time, those 3 hours, it's a valuable amount of time for a healthcare worker. That in 3 hours you can see a lot of patients and potentially save a lot of lives. So we think that this benefit is really important to help health workers get back to their core job, which is taking care of people. And below that, you can see there was a dramatic reduction in the rates of stockouts in Mozambique. 19% stockout rate without OpenLMIS using a paper-based system, and a 5% stockout rate with OpenLMIS. And we see the data is consistent across our different countries, that stockouts are reduced. And the next slide, I just wanted to read a quote. We do try to look both at data, and we also look at qualitative feedback that we're getting from our users. And this is a quote from one of the medical chiefs in one of our implementing countries. He said, "With OpenLMIS, we have an accurate view of actual consumption. Before, it was hard to know what we actually needed. Having access to this data has helped us to reduce stockouts and also to address the issue of overstocking." So in summary, what we can gather from this quote, and it's something that we hear sort of consistently from our users and from the ministries of health that we partner with, that the system helps for governments to plan for the future and reduce stockouts and overstocks, which improves availability of products, but it also saves governments money. When you have an overstock of products, products expire, and you're wasting money on products that you will never use. You'll just have to dispose of them. And stockouts also cost money, because when you realize you have a stockout, you need to issue an emergency order and order a truck. So both of these things, reduction of stockouts and reducing overstocks, are also money-saving mechanisms for governments. I just wanted to touch a little bit on how you, as the general public or other actors in global health or in supply chain or even in technology, can get involved with the initiative, as we're always eager to take on new perspectives and new partners. So we encourage you to join the community. We're always looking for new individuals and also new organizations to join us, particularly if they're our expertise in software development, supply chain, health in general, or global health. But as I mentioned before, we are really excited that we've started working more in the Asia region. We currently have 2 partners based in Asia. We are working with the Empower School of Health, who are based in India, and also a software company based in Bangladesh called Softworks. And we're really hoping to expand that partner network for organizations that can help us do on-the-ground implementations through Asia, and also just add a voice from the perspective on the Asian continent. And we know that AeHIN has a great network of really seasoned experts, and so we continue to encourage you to reach out to us to get more information, or talk to me if you're interested in developing sort of a more formal partnership. And I'm sure we'll share contact information and different links after the webinar. Here are a few ways that you or others could find out more about our community if you're interested in digging into some more details. The first way is through our website, which is sort of our most externally facing resource. On our website, we update it pretty regularly with blog posts. We have lots of different outlines of the features of OpenLMIS, other resource documents. One to highlight would be our implementer toolkit. We have a whole toolkit that sort of walks a user or a country through the process and sort of the steps that one would need to take and key considerations for implementing OpenLMIS. So I encourage you all to visit our website to look at that. And in terms of our community, we have a wiki which serves as our sort of online workspace for the community and all the different partners. So all partners have access to the wiki and can edit and update it. And this contains our our committee meeting notes, sort of descriptions of community roles. It outlines our project management structure, and some of you all may be interested to see our living product roadmap, which is really a map of the different features that we plan to add to OpenLMIS over the future. So it sort of gives you a vision of where we're going in the next 6 months, where we're going in the next year, and how the software will continue to be improved. And we also, for the technical folks in the audience, we have technical documentation, which contains more developer-oriented documents. And so things like ERD schemes, the coding style, API documentation. This documentation is quite detailed, and we can share the link for anyone who's interested in that after the webinar. And for anyone who's a more visual learner or just wants to watch some videos, OpenLMIS has a YouTube channel as well. So we have some short demo videos where you can actually see the software and its different features being showcased. So if you're curious about how we work with vaccines or how we do some of our cold chain work, which we didn't have a chance to show today, you can look on our YouTube channel. We've also got some past webinars, and particularly we have a couple that are in French and Portuguese as well, because we work in French and Portuguese speaking countries. And that's sort of OpenLMIS in a nutshell. We've gone through the features and the community. I know we've done it all rather quickly, so we encourage you to ask both of us questions and use this opportunity to get any information that you are looking for. And here on the screen, you can see our website again and a contact email address that will go straight to me if you're looking for further information or want to have a conversation about joining the community. So thank you for your time.
Thank you, Ms. Rebecca and Sir Wes. So we're now open for questions. Please feel free to type your questions in the questions box. So for the first question, someone is asking if OpenLMIS is already being used in Rwanda.
I can answer that question. OpenLMIS is not being used in Rwanda. I think they have a different system. I'm not sure the name of it, but that's not one of our implementation countries currently.
Okay, thank you, Ms. Rebecca. Our next question is from Dr. Chamika. He has 3 questions. So for the first one, it is what are the technologies used, PHP or Java, in the database?
Yeah, I can answer that. So this is a Java-based system. We use Postgres for the database. We follow a microservice architecture, and we try to do all of our implementations within, in terms of deployment and also actually development within Docker instances. I can get into more detail if you'd like, or leave it at that. But yeah, that's the kind of the main tech stack that we're using.
Thank you, Sir Wes. The next question is for data entry, what is the session timeout limit?
So because this is a web-based system, there is no session timeout really. I guess in terms of automatically logging you out, that is a configurable property that you can specify when you're doing your implementation. I don't remember what the default is, honestly. I think it's somewhere between 10 and 30 minutes, something like that. It does have checks though that if you try to log in as a user that's already logged in somewhere else, it will log that person out. So I'm not quite sure what the specific context for that question was, but yeah, because it's a web-based system, the only kind of session timeout I can think would be for logging a user out, which is, yeah.
All right. The next question is quite long, Sir Wes. Does it provide?
I can actually read it here. Would you like me to just read
yes.
it? So
yes,
the question
okay.
was, does it provide a customized dashboard facilities, or the report module is separately included? Does it provide customized user-specific report generation, or are reports predefined? Yeah, so your third question is a big one. That's a good one. In terms of the dashboard, we don't have a dashboard within OpenLMIS. The reports that we can provide do provide some view of that. In fact, most of the reports, instead of getting a single report, you actually get a report dashboard that would show a bunch of different reports related to the area that you're looking at. For example, if you wanted to see reports related to orders, you're going to see a number of different reports that show or graphs or charts, whatever they may be, on one screen. The report module it's incorporated into the overall deployment of the system, but it is implemented as a separate piece because it exists in its own database, and it does like a real-time data transfer from the main database, so that the queries that are being run are not impacting a production system. But it is included as part of the deployment of OpenLMIS. So even though it can sit topographically in a separate virtual instance of something that you're running, it's part of OpenLMIS. And then to your last question, we provide the ability to create your own customized reports if you want to. You can also customize the existing reports that we have, and we do have I think it's 7 predefined report dashboards. Once again, not reports individual, but report dashboards that include a number of different reports in them as part of our implementation. I think I got to all those questions. Oh, there's a fourth one there, actually.
Yes.
Okay. The fourth one was, is there any module to identify buffer stock ranges? So that would be something that we would probably have to add into the inventory module. And I do not think that we have that. To be honest, I'm not entirely sure exactly what that is. I have an idea based on buffering stocks, but I don't think that we have that specific feature. No.
Right. Thank you, sir. The next question is from Dr. Pradeep. It reads, does OpenLMIS inventory management integrate the support of geographic information systems with RFID tagging procedures for tracking the flow of inventory or stocks?
I think I can probably answer this one as well. So out of the box, it does not have this specific. Like I mentioned when I was talking about the stock management functionality that OpenLMIS has, it's focused and intended to be simplified down to facilitating the requisition process, which is the heart of what OpenLMIS provides. However, the system as it currently is defined does allow you to enter in custom pieces of information with stock. So in theory, you could add this information in. It just wouldn't be like a first-class citizen within the system. And so I think my answer would probably be no, but it would actually be very interesting to know if there was an easy way for us to add it in.
Thank you, Sir Wes. We have another question. It's from Dr. Sujan. Dr. Sujan is asking, what is the data model to send the stock and other summary reports in DHIS2? And is it possible to send individual purchase and requisition data in DHIS2?
I think this is another one for me. That's a very good question. So the integration that we have with DHIS2 tends to be much more about the usage rates of medical supplies at facilities. We have 2 main reports. We have the measure and measure reports that we're sending to DHIS2. I'm trying to understand how that maps up to your specific question. What is the data model? I'm sorry, Juhas, I'm not quite sure what kind of data model you're referring to. So to the second part of your question, is it possible to send individual purchase and requisition data to DHIS2? It's possible. I mean, we have all of that data within the system. We would just need to map the data fields that we have in OpenLMIS to the specifics for the DHIS2 instance that you would be wanting to communicate with. I'm not sure if that data, quite honestly, I'm not sure if that's included in the measure and measure reports that we're sending to DHIS2 right now. I'm not familiar enough with that.
All right. Our next question, sir, was Dr. Marma is interested in using OpenLMIS, I think. So he's asking about the process.
Actually, I can field that one. So if there's anyone who's interested in getting more information about what it would take to use the software or to deploy it at a larger scale, they can reach out to me individually. So the email that's on the screen now, info@openlmis.org. Those emails will go straight to my inbox, and we can have a conversation more about specifically what the intended use case is and dive into a little bit more detail about what programs it would be used for, so we can get a sense of the scale and the scope. And then we sort of go from there. Once we know more details about how you'd like to use the system, we then communicate with the implementing partners that we have to see who would be best placed to support that implementation and do the sort of technical work on the ground and the project management work to set up and deploy the system. So it's sort of a multi-step process, which is why I think anyone who's interested in either learning more or talking about a deployment can just reach out to me directly and we can talk about your specific case.
Great. Thank you, Ms. Rebecca. I think that's the last question. There's no other questions coming in so far. So, is there any more questions from our participants? I think there's none already, so I think we can wrap up the session. So thank you, Ms. Rebecca and Sir Wes, for sharing your work with us, and also for the participants for actively participating in this webinar. So if you missed any part of this webinar, we will be making the recording available on our website soon, so you can review it. Thank you, everyone.
Thank
Thank
you
you
very
for
much.
having us.
Thank you. Bye.